health care has been going along. You know, it's a negotiation, so I do. And it's just a negotiation, and it's going to take a little while longer. But as you're probably hearing, Congress is coming along. We have some great people at Congress. They want it to happen. We will have no Democrats, 0. That means we have to get close to 100% of the Republicans. Not an easy to run a government.
So that from yesterday now, and reports today that the White House is considering a new strategy to bring Congress back to the table, and that would be by doing away with Obamacare subsidies. Here's what the president told the Wall Street Journal, quote, Obamacare is dead next month if it doesn't get that money. I haven't made my viewpoint clear yet. I don't want people to get hurt. What I think should happen and will happen is the Democrats will start calling me and negotiating. Is that the case? Republican Congressman Pete Roskam of Illinois chairs the House and Ways and Means Committee tax policy. Sir, how are you? And good morning.
I'm doing well, Bill.
From Chicago.
Good morning. Great to be with you.
Get rid of subsidies. Is that the way you negotiate this next? Is that what's developing,
Well, look,
sir?
I think we're in a tough spot, and I think we would be better off to dump the current bill and actually start out and pass the bill out to which everybody aspires. And unfortunately, over the past several years, and myself included, we didn't do that hard work. But had we done it, we would have been able to pass a bill out of the House, send it over to the Senate, probably be subject to a filibuster, obviously. Then the Senate can come up through their complicated rules, this notion of reconciliation, and we can go from there. So I think we're in a spot where this doesn't get any easier quickly, and my preference is to dump the current bill, move on, take a longer time frame all the way out, and take more of a running start to get this done.
Come back to the question, though. If you ditch the subsidies, would that be incentive for moderate Democrats to get on board, yes or no?
No, basically right now everybody's playing a political game of not it. So essentially Republicans are saying, look, we didn't create Obamacare, and it's starting to fail. Democrats are going to come right back and say, well, if these subsidies don't happen, then that's going to be contributing to the failure. So this is my point of getting out of this current paradigm, which is going nowhere fast in my view. Dump the current bill, move forward, and try and just frame this debate entirely differently. I think for a while, and it doesn't look to me like we're moving very quickly out of where we are right now.
Let me play a quick clip from Zeke Emanuel speaking with Fox yesterday. And a lot of people think he's the architect of Obamacare. He said the following as a Fox News contributor.
It would be seriously destabilizing in 2 ways. First of all, just saying we're not going to pay them would make a lot of insurance companies leave. And the second element of destabilization is that the insurance premiums would skyrocket between 10 and 20%, it's estimated.
Is that incentive?
Well, I don't think it's an incentive for anybody to come to the table, unfortunately. And what ends up happening is you've got both sides. I mean, look, Obamacare at its architecture, at its foundation, is a failure, and it's collapsing quickly. Now, the irony is that there's a responsibility or a perceived responsibility to continue a subsidy to prop up something that is failing. And I keep getting back to this core idea of drop this current negotiation and essentially start over, slow it down, and don't have an arbitrary date.
The president also said that he wants to do health care before tax reform. And if you do health care first, you will get tax reform. Do you agree with that logic?
Well, I think that that's the aspiration, to do health care before tax reform, but it's not necessary to do health care before tax reform. So in other words, both of these things can move through on simultaneous tracks, and the notion that they're mutually exclusive somehow from a procedural point of view, I think, is overstated. Is it a preference to get one done and then the other? Sure. But is it an absolute necessity from a procedural point of view? I don't think so.
Interesting. Okay. So he was making the argument the money you save on the health care could go into a tax reform bill. Third topic, Lois
Well, I think
Lerner.
the money that you save...
Go ahead.
Yeah. Just quickly, I think the money that you save on health care is largely going to be spent in health care, but I take his larger point.
Okay. Lois Lerner, apparently 4 years on, you want to reopen this investigation for a, quote, fresh look. What have you found that would justify that?
We found absolutely nothing new, but we're convinced that the prior administration was completely dismissive of the referral from the Congress. that said, we believe Lois Lerner committed crimes. Remember, while that investigation, so-called, was going on, President Obama was on television giving an interview saying there's not a smidgen of wrongdoing here. All right, so what does that mean? That means that the previous administration didn't take this seriously. We think a new administration should be looking at a couple of things. Number one, we're asserting, the Ways and Means Committee is asserting, that Lois Lerner is likely to have committed a crime in the denial of due process and equal protection by targeting individuals based on their political philosophy. And we're also asserting that we think that she misled fundamentally the Inspector General on this issue. We think a new Justice Department should look at this and do this review with the idea of bringing this case, because the notion of weaponizing the IRS is so corrosive to our democracy. We ought not let the statute of limitations lapse without taking another look at it.
Got to keep the faith in the American people. We'll see if you get anywhere with that. Peter Roskam, thank you, sir. The Republican from Illinois in Chicago today. Nice to have you.